Okay, so I'm trying to explain what is known as a Murphy's sign. Murphy's sign. So Murphy's sign is a thing that is usually seen in acute cholecystitis. You always see that in acute cholecystitis. So okay, I think we're trying to give like anatomical facts, right? But this was a question, right? This was a question that was asked in an exam. So students were now asked to now give the reason. Okay. So the question was this. They said that as a cholecystitis, cholelithiasis, right, progresses, the impacted gallbladders cause distension of the gallbladder, which compromises what? Its arterial blood and venous and also drainage and lymphatic drainage. So this results in inflammation of the gallbladder. That's a condition known as acute cholecystitis. So the clinical sign for this stage of disease is called a positive Murphy's sign. Alright, positive Murphy's sign. So they said that when a finger is placed just below the costal margin at the tip of the 9th costal cartilage, the patient feels a very sharp pain on inspiration. He winces with a catch in his breath. So what is the anatomical fact to explain why there will be pain here if there's inflammation of the gallbladder? Okay, so let's go. So Murphy's sign is just basically based on anatomical positions and movement of the gallbladder during respiration. So anatomical basis is due to the location of the gallbladder. So the gallbladder is located underneath the liver in the right upper quadrant of the abdomen. Okay, just below the 9th costal cartilage. So diaphragm movement. So during inspiration, the diaphragm moves downward, pushing the liver and the gallbladder downward as well. So if your gallbladder is inflamed, it becomes tender, alright, and very sensitive to touch. So if you touch it around this place, you are basically, okay, not really pressing the gallbladder, but if you ask the patient to breathe in and out, alright, that's why they actually feel the pain. So what's the mechanism of Murphy's sign? So the examiner places a finger just below the costal margin at the tip of the 9th costal cartilage. Inspiration. The patient inhales deeply, the gallbladder moves downward and comes in contact to the examiner's finger. So pain response is, if the gallbladder is inflamed, this contact causes a lot of sharp pain, causing the patient to actually wince and stop breathing abruptly. Okay, so this is how you actually do to elicit a Murphy's sign.